An update on our local numbers today. We have had 2 new cases overnight. Both are international travellers who are in hotel quarantine. That brings our total number of cases to 861. Now to what is happening in New South Wales and Victoria and how we are proposing to deal with it. This is an evolving situation that is changing day by day, even hour by hour. It began with an outbreak in the Northern Beaches area of Sydney after a long period of no community transmission. This led to Western Australia reclassifying New South Wales initially as low risk and then later to medium risk. This effectively meant we once again put up a hard border with New South Wales. Today, Victoria and South Australia have taken the same action which Western Australia took on the 19th of December. They have also closed their borders to New South Wales. We took that decisive action early to protect Western Australia because of the unpredictable situation in New South Wales. Since then, the tentacles of that original outbreak in Sydney have been spreading slowly but surely. We have been watching with great caution, ready to act if necessary. What has happened since Christmas is the original Avalon cluster has now spread to other suburbs in Greater Sydney. And yesterday, we saw those enormous queues of people waiting to be tested south of Sydney in Wollongong. Then, what we feared happened occurred. It would appear the virus has jumped the border into Victoria. Late yesterday, there were 3 confirmed cases of COVID-19 near Melbourne, after the state had gone 2 months without community transmission. Those cases have possible links to the Sydney outbreaks. Today, a further 5 cases have been confirmed. That brings the total of live community cases in Victoria to 8. So clearly, we are dealing with an unpredictable situation which is likely to get worse before it gets better. This morning, the nation's chief health officers, the AHPPC, met to discuss the situation on the East Coast. We then had a meeting of our emergency team to discuss the health advice. There were several outcomes from that meeting, which I will now detail. Victoria and South Australia have today taken the same action which Western Australia took on the 19th of December. They are closing their borders to New South Wales. In light of the outbreak in Victoria, Western Australia will strengthen its border controls to reduce the risk of the virus coming into our community. Based on the latest health advice and the evolving situation, Victoria will now transition from a very low-risk state to a medium-risk state under our controlled interstate border arrangements. Effective from 12:01 a.m. tonight, travel from Victoria will no longer be permitted unless you are an exempt traveller. The list of exemptions will be the same as New South Wales. But we also realise this will cause some inconvenience to Western Australians who have gone to Victoria for Christmas and need to return home. And we don't want them to get caught out. So they will be dealt with on a compassionate basis, case by case, by WA Police, to do what we can to help them out. But because of the situation in Victoria, the risk there, these returning Western Australians will have to self-quarantine for 14 days when they arrive back home, and they will need to have a day 11 COVID-19 test. We know this will unfortunately cause some inconvenience and unhappiness. We will work with airlines and the airport to manage this situation as best we can. What we also decided this morning is how to deal with the people who have arrived in Western Australia from Victoria in recent days by air and road. Now that the virus is in Victoria, there is the potential that they could have been exposed before they travelled to Western Australia. So that is a risk we need to manage quickly. Effective immediately, anyone who arrived in Western Australia from Victoria on or after the 21st of December, I repeat, since the 21st of December, or was in Victoria on or after the 21st of December and has since arrived here are required to do the following. They will need to self-quarantine immediately. They will need to be in self-quarantine for 14 days from when they arrived in Western Australia and get a COVID-19 test at any point symptoms develop. They will also need to present to a COVID-19 clinic for a test on day 11 after their arrival. So, for example, if someone arrived here on the 21st of December, they will need to go into self-quarantine until the 4th of January. They will need to have a day 11 test tomorrow, which is 11 days after they arrived in Western Australia. This decision does not affect anyone who arrived here before the 21st of December. Look, the timing is terrible, but COVID-19 doesn't respect dates, it doesn't respect celebrations. What it means is people who are here from Victoria cannot go out tonight on New Year's Eve. It is really unfortunate, but it is necessary that they stay home. We just cannot afford to take the risk. This afternoon, we will be contacting everyone who arrived here from the 21st of December onwards to tell them of what is expected of them. We are able to do this because of the G2G pass application process which has been put in WA. There is going to be a lot of people needing to get a day 11 test in the coming days. So in the coming days, we will be making the necessary arrangements for people to get their day 11 tests. The Health Department is preparing our COVID-19 clinics for a surge of people presenting for tests. We have seen long lines outside COVID-19 clinics on the East Coast in the past week. Those images are becoming very familiar. Even with a surge of health staff and additional operating hours, it is likely we will see queues at our clinics. This is the world we live in right now, and I thank everyone for their patience and for their understanding. I also want to add, if you have recently been in contact with someone from Victoria in WA, you do not need to be tested. But the general rule continues to apply. If you develop any symptoms, get a test. I hope we don't have the same long lines here in WA, but what I do ask is for everyone to be patient and understanding if there is some time to wait for their test. These decisions do not come easily. They are not easy decisions to make. We know every time we make decisions like this, we have a big impact on people. They are restrictions that we would prefer not to put in place, but they are decisions based on the best health advice that we have to make and that we have to take in order to keep Western Australians safe. Our state has been in the enviable position of being free of COVID-19 in the community for almost 9 months now. And that is because of the swift actions that we have taken and the sacrifices that we have made collectively as a community. That is why we've been so successful together in 2020. But we all know this cannot be taken for granted. New, more virulent strains of the COVID-19 virus are emerging. The United States has just had over 200,000 positive cases in a single day again. The United Kingdom is dealing with record numbers of infections and record numbers of deaths. This is an extremely dangerous time for everyone. The outbreaks in New South Wales and Victoria are a direct consequence of what is happening overseas at this very moment. We share the pain of our friends on the East Coast. But at the same time, we will take the necessary measures in the interest of the people of Western Australia to keep our community safe. And that is why we have taken these actions today. I'll now hand you over to the Police Commissioner.
Good afternoon. I'll just make several points. Since the 21st of December, there have been over 16,000 people arrive in WA from Victoria by air or road. This includes about 1,500 people that have either arrived already today or are scheduled to arrive on a total of 8 flights from Melbourne today into Perth Airport. We will be recognising that many travellers from Victoria may have already returned home after Christmas visits. But what we are doing is messaging all such people who have the G2G pass system. That is, every traveller that comes into Western Australia have to have a G2G pass. So we will be emailing them and making phone contact to advise of changes to the travel conditions. Those persons that have arrived, I strongly recommend that you enlist the G2G Now app. That enables you, when you go into self-isolation, to be able to be subject of a virtual check through your smartphone. That's the G2G Now app, which you can download. Otherwise, you can expect a physical knock on the door from police, who will be checking to make sure that you are complying with the new arrangements, which are that you're going to have to remain in self-isolation. It has been the practice previously, when we've had to make further changes to our controlled borders, that all G2G approvals, that is those people that are yet to arrive, we've had to cancel those applications, and that's exactly what will happen again today. And travellers will be asked to reapply. So if you have an existing approval and you're yet to arrive into Western Australia, then you will have to reapply because the conditions have changed. We will once again follow up with emails and texts to inform you of these changes. We'll do the same for those persons travelling from Victoria on this occasion, so that means communicating with them, as I've spoken of previously, and advising that the approvals will now be cancelled from midnight tonight. The emergency directions that I'm signing this afternoon come into effect at 1 minute past midnight tomorrow, the 1st of January 2021. For those people arriving at the airport this afternoon, they will all be greeted by Western Australian Police and WA health officials, and they will be informed of the new arrangements. We appreciate that many of those travellers will be surprised that, in fact, the rules have changed while they're in the air, but that is the very nature of this quick-changing virus and this pandemic. Once again, we're making these changes to protect all persons, and we're discriminating against a virus. If you have any questions, we ask that you call the 13 COVID telephone line or check the WA government website. There are a lot of FAQs that you can check and see the situation that has now changed for you, how you can best comply, and also the arrangements as to where you can attend a COVID clinic. If you're in the country, you attend a regional hospital, but all those are listed on the WA government and the health websites. Thank you.
On the 2 p.m. flight that are just about to touch down, what does this mean for them? Are they turned around or do they quarantine?
No, they'll be asked to quarantine, but on their election, if they have another flight seat available to return, they can of course do that. But ordinarily, they'll be required to comply with the new arrangements and remain in isolation for 14 days on arrival.
So if they're Victorians and they want to go back, but they can't get on a flight till tomorrow, is that allowable? Or?
Talk to the police on arrival, and it'll be depending on the availability of flights. Okay.
Okay, any other questions?
Testing kind of went pretty wild last time when we brought in sudden change to Sydney. Will clinics be operating later tonight? Do you think we're going to see less of a scramble as we did last time around?
Yeah, well, last time when we had this situation, we tested that backlog of New South Wales visitors. People were waiting up to 4 hours. I note that in Wollongong there yesterday and other places they waited over 10. But we cleared that backlog within 24 hours. But this time we are obviously learnt from that experience, and we expect more staff and longer opening hours, and we'll provide those details as soon as possible. I would just note, however, that rather than having all that group of people who have arrived being tested all at once. They'll be tested on day 11 of their arrival. So, for instance, on the 21st of December, I think it was around about 800 arrivals from Victoria that day. That includes people who have already returned to Victoria, plus also those people who are flight crews and have obviously left the state. So we're not expecting a huge influx to our clinics. What you will see over an increase in the number of people presenting over the next 2 weeks, and that will ultimately basically play out. So we believe the clinics will be able to deal with it. We'll also incorporate and enlist the support of the private pathology clinics, but obviously they've got interrupted operating hours during Christmas period. So we'll provide more details of those when they come to hand.
Why have you gone straight to a hard border?
Why are we going so straight to a hard border this time rather than with New South Wales we had that self-isolation period?
Well, this is consistent with our approach to South Australia. In South Australia, we saw an emerging situation which we thought would continue to increase in relation to the scale of the problem. We can see an emerging pattern in relation to Victoria, particularly in terms of their exposure to New South Wales. So we think that it's appropriate to move straight to the medium risk.
You mentioned the more virulent strains of coronavirus than most overseas. Do we know yet if any of the people in the Melbourne outbreak or the New South Wales outbreak have that more virulent strain?
No, we don't have those details. To the best of our knowledge, that these are the same. This is the same strain that we saw in the Avalon outbreak. And we certainly hope that we don't have a situation where those more virulent strains get out into the community. But it does underscore the danger and the concern that we have in relation to any outbreak of this disease. That's why we have to get on top of it now. We have to move quickly and make sure we get on top of it now.
When this happened with New South Wales, you didn't force people to retrospectively have to quarantine for 14 days. Why have you made that decision this year?
Well, essentially what we are doing is taking Victoria to a low-risk jurisdiction from the 21st of December. So if we had done it back then, now knowing what we now know, which is that is generally, I think, the accepted date that the virus entered that community, and if we had put these in place, well, that's the date that those people would have been required to self-isolate from. So it's an appropriate response to an emerging situation.
So you're treating Victoria as if it was New South Wales?
No, we're treating Victoria on the basis of the size of the outbreak and the nature of the outbreak. We believe going to a medium risk, particularly in the context of the large movement of people between the states, is an appropriate response.
But those people who are already here in terms of self-isolation, when people come into places like New South Wales now, they need to stay in separate apartments and separate arrangements. How does that work for these people who are already here from Victoria? Do they have to sort that out now in their current arrangements?
Well, the message is to work with police and obviously work with the advice on the 13 COVID line to get good guidance and advice in relation to those matters. Look, we know this isn't going to be a perfect situation, but we know it's a very dangerous situation and it's one that we have to move swiftly on.
How much leeway for the families of people coming to Melbourne for holidays? They might have return flights scheduled for another few days away. Obviously, trying to change flights now, they're quite expensive. It's thousands to come back if you just want to change the flights. How much leeway will people have in terms of being able to come back? They're reapplied for their good to go passes.
Yep.
The level of compassion that will be there for them to re-enter.
Look, I believe there will be scope for that, and I'll invite the Commission to make some comments further about what that looks like on the ground. But essentially what we are trying to do is to provide a compassionate opportunity for people, for Western Australians, particularly those who have only very recently flown to Victoria, to be able to return in the course of the next few days. Obviously, the message is that you need to make sure that you make an application through your G2G app, and ensure that you can work with the police in relation to those matters. We're not going to take a punitive approach to this. We want Western Australians to be able to return. And the way we did that with New South Wales is to provide a compassionate approach on a case-by-case basis. It worked very well, and we'll be utilising the same approach in the case of Victorians.
Just to be clear, can you guarantee that any West Australian that went over to Victoria for Christmas will be permitted to come back on compassionate grounds?
Yeah, look, I'll ask the Police Commissioner shortly to provide you with an idea of what that looks like on the ground and how that works. But my understanding is that it worked very well in the case of the emerging situation in New South Wales.
Should West Australians avoid interstate travel at the moment?
Well, look, the message is that whenever you travel anywhere in this world, in the current climate, you are at risk of a very changeable situation, an unpredictable situation, overtaking your travel plans. And that's simply the reality of travel in 2020. So I caution everyone who's seeking to travel interstate to just make sure that you take the very best of precautions, make sure your travel arrangements are flexible, and I don't recommend travelling to Victoria or New South Wales.
What about anywhere else? Queensland, Tasmania?
Well, each of those states are very low risk, and you've seen South Australia and Queensland change their attitude towards their borders with New South Wales today. They've just been announced. That's a sign of their concern about any outbreak of the disease in their communities. And it's important for people to remember that if there is an outbreak of disease in those communities, well, then we will act, and we will act swiftly. So that's the caution I add to anyone travelling, is that it's a very changeable situation. So don't purchase an airline ticket if you're visiting relatives in Queensland or South Australia, which doesn't allow you the flexibility of returning immediately if that's what's required. Well, look, the initial outbreak was unusual in that it was a highly constrained or confined cluster. So I understand the approach they took. You would have heard the Premier recently provide some analysis that we would have liked them to see them go harder and earlier. But it's easy to be wise in retrospect. They are doing everything they can to get on top of it, including doing some amazing levels of testing to make sure that they understand where the disease is in their community.
They still haven't gone into lockdown though. Should they be taking that step?
Well, that's for them to decide, but certainly our approach in Western Australia would be to lock down quickly and to get on top of the situation to kill the virus in the community. That's the approach that we believe is appropriate to get on top of any community outbreak. In New South Wales, they're getting on top of it, but it's, as you can see, the longer you take to ramp up these measures, the longer it takes to get on top of the disease.
A lot of people happy to see the end of 2020, but from midnight on January 1st, we're back to a hard border. This isn't going to be over for a long time.
Look, COVID-19 is going to be with us for some time yet. We just have to get used to the fact that it will be in our lives for a period of time until we have that penetration of effective vaccines which allow us to get it under control by other means. This is the best means that we have at the moment of protecting Western Australians, which is the reason why we act quickly and we act decisively to make sure that we can protect Western Australians by getting on top of any outbreak wherever it occurs.
Is there any consideration to bringing back an across-the-board hard border?
Look, we respond to the health advice in relation to all our border arrangements and indeed all the arrangements that we have in place. We've received no advice at the moment that would suggest that we need to look further than New South Wales or Victoria. Other states are now moving to place hard borders against New South Wales and are watching Victoria carefully. And obviously we've moved early and decisively, like we did in the case of New South Wales, to protect Western Australians.
What's your advice to West Australians for New Year's Eve in the context of these concerns?
Well, look, it really underpins, doesn't it? Just underscores just how dangerous the world is at the moment. So please enjoy yourself by all means, but be aware that these are risky times. Observe physical distancing, observe good personal hygiene, and above all else, if you are in any way symptomatic, make sure you get yourself tested and stay away from other people until you've had a negative result. We can only do this together. We can only do this if we all take personal responsibility, doing our bit to make sure that we continue to keep on top of COVID-19.
What about sporting teams that are currently in Melbourne to play games? What will happen to them? Will they be forced to quarantine when they come back?
Well, the rules apply to everyone. They apply to those who are powerful, those who are in sports teams, those who are just everyday Western Australians. But the rules are in place to make sure that we ensure that we keep Western Australians safe. Commissioner, would you like to comment just on the arrangements for returning Western Australians?
With the numbers of people that we're expecting to return, as I mentioned earlier, we've had upwards of 16,000 arrive since the 21st of December. We also appreciate many Western Australians, of course, have travelled to places like Melbourne for family Christmas gatherings, etc. As we did when we previously had to adjust the borders with the people that did the same with Sydney and Greater New South Wales, we will assess each case on its merit. I want to make it very clear, though, people just need to be truthful in their applications, explain that they're returning Western Australians, and we will deal with them compassionately. It worked well last time. I anticipate we'll do the same. We know that there's been 3,000 people, for instance, come across the Nullarbor, and we will have police officers waiting at Eucla. And again, we want to be compassionate about people that have made the trip across, and then, of course, the rules have once again changed. It'll be explained very clearly. We'll deal with them on a case-by-case basis, and I just don't want people to simply try and change the facts to suit their own personal circumstances. We dealt with this appropriately and I think responsibly last time, and I see no reason why we shouldn't repeat that.
Those 3,000 people that come across the Nullarbor, is that since December 21?
Yes.
So just to be clear, sorry, that's 3,000 arrivals from Victoria into WA since December 21.
They've come across the South Australian, West Australian border, so whether they've travelled directly from Victoria or they've travelled via Victoria, our assessment is, based on our GTG data, there's just under 3,000 that have travelled by road.
And so do you have any information on how many people will have to self-isolate as a result of these changes then?
Oh, we have in the order of 16,000 people who will have to self-isolate that have been in Victoria since the 21st of December. So we appreciate it impacts on a lot of people. But look, I'd echo what the Acting Premier said. It's a festive time of year. We want people to be responsible, enjoy yourselves, but we will deal with this as best as we can. There are thousands of police, there are thousands of emergency department nurses and others working tonight, for instance. It's New Year's night, it's one of the busiest nights of the year. We know people will want to party, but we ask for your forbearance, for your patience and for your common sense. There's lots of people out there working, not celebrating, and tomorrow there'll be thousands more working. They won't have the opportunity to holiday as others will, and we want you to exercise some patience, some good judgment. We'll all get through this together.
Do you expect that maybe those 16,000 wouldn't have to be in homes that would allow them to self-isolate safely at home? But are you confident there's enough space in our health and quarantine system to accommodate those people?
Look, we've got space, but what we will ask is that the self-isolation invites people to be able to stay in what is termed suitable premises. So clearly, if you're in a classic 4x2 home, use one set of amenities and don't mix with other people. I would like to reinforce what Dr. Robin Lawrence asked me to reinforce and has already been said here today. If you're in contact with people who've travelled through Victoria in the last 14 days and you're a West Australian, you haven't been out of WA, if you are symptomatic and you're feeling unwell, go and get tested, irrespective of whether you've travelled there or not, because you may well unwittingly have come in contact with people. And if you're symptomatic, we ask that you also go to the COVID clinic. Thanks very much.
Sorry, in terms of the 16,000, do you know how many of those might have come from the locations where the virus has been detected in Melbourne, suburban areas?
No. Look, it's an evolving situation. We know that there's 3 to 5 suburbs that I've seen in the briefings this morning, and while we'll have particulars of where people might reside, we won't necessarily know where they've eaten, where they've shopped, or where they've travelled. So that is quite complex and difficult. So again, we're appealing to the community: use common sense, use good judgment. Go and get yourself tested, and clearly, in any questions that people might have about the self-isolation, check on the FAQ on our website, and also ring 13 COVID. And clearly, we'll have police greeting people on arrival at the airport, and we just appeal for people just to inform themselves, and we'll help as much as we can.
Will arrivals after midnight be tested at the airport?
Yes, they'll be tested on arrival, and they'll also be required to be tested again on day 11. They'll have to do their full 14 days.
Can I just quickly clarify that 21st date? Because I think a lot of people out there will be going, why has it been backdated back to the 21st? What's the relevance of that date?
Look, that's the date that is being I guess, the emerging consensus date that they've had that mixture between New South Wales positive cases and Victorian positive cases. So that point about which it is emerging in Victoria. So obviously there's a lot of work being done in Victoria at the moment to understand the index case, the rate of spread, and the points and the locations of that spread. But 21st is the date that the Acting Chief Health Officer has given to us as the operable date.
Well, the 21st is when they think that the returned traveller from New South Wales...
Is when there was that initial spread, that's correct. Oh, sorry, yes.
So we will, if we do get an outbreak here, we go into lockdown. How many local cases would it take? Would it be just one case of community spread with lockdown WA, or...?
Well, with any outbreak, it would be on the basis of what the nature of that outbreak is and the size of the outbreak. But we would, I think you've seen the Premier's attitude towards these things and that of the Chief Health Officer. We would move very quickly to make sure that we had broad-based arrangements in place to ensure that there's no leakage from that particular outbreak. Thanks. Oh, sorry. Yes.
One more. What's the theory behind moving straight to medium risk for Victoria? With New South Wales, when people had arrived, retrospectively, they only had to do a day and have a negative test. What's the theory with Victoria this time around? Why is the risk higher?
Well, it's based on the advice from the Acting Chief Health Officer, and in addition to that, it's based on the same approach that we took in relation to South Australia. And that is, you saw an outbreak in South Australia, we moved straight to a medium risk, which allowed us to make sure that Western Australia wasn't exposed. In this case, you've seen a situation where there is the outbreak, but also there's the potential additional impact of other cases from New South Wales. So we're acting with the abundance of caution, and we're acting with the sole intent of keeping Western Australians safe. Thanks very much, everyone.